Good afternoon, everyone, and welcome to Medicare 101, the class that you are never going to get old enough to have to attend. My name is Jerry Maher. I'm a volunteer with the Senior LinkAge line, and I do presentations like this quite frequently around the metro area. We're going to be discussing Medicare generally in the same order as this little booklet that you have called Medicare 101. That's kind of the very basics, and I'm going to be selling hard on a book called Healthcare Choices for Minnesotans on Medicare. It's not really too hard to sell because it's free, but the thing you do, you really need a copy of this book to stay on top of Medicare. And you call the Senior LinkAge line at the number that's on your Medicare 101 book, tell them to mail you one, and they'll send it out. And you need to get this every fall. It's published October, November, has all of the information on all of the health plans and all the new changes in Medicare and so on and so forth for the upcoming year. And the third publication is the one that has already been mentioned. This is Medicare and You, comes from CMS, the federal government, every September roughly, and it has all the basic information for Medicare. It also has some of the new information. One thing that I'd like to warn you about, in the back it has some health plan information that is always obsolete because they publish the book before the new plans for the upcoming year are approved. So don't pay attention to the back of the book. The rest of it is great. It's basically quite readable. I think they probably published it when their lawyers were on vacation or something, but good book. Be sure you read it, and once you've read it once, they'll tell you what the changes are in the index, and you just have to read those, and if they don't apply to you, put it in the file and you're ready to go. Let's tell you a little bit about the Senior LinkAge line. It's a resource that everybody needs to know. This is a free statewide service by the Board of Aging. It has 6 different agencies throughout the state, covers all 87 counties, has expertise in health insurance, long-term care options, and many, many other things affecting seniors. So if you have any question at all about not only Medicare, long-term care, other resources available in your county, or if you happen to have a relative or a friend in another county, you want to know what you can do to help them, Senior LinkAge line is there to do that too. And very important, we don't sell, market, promote, or anything, any insurance products. Even though I might mention an insurance company today, I'm not telling you that I'm endorsing it or not endorsing it. We don't sell insurance. I had a period in my life when I did sell insurance, but that's long gone. Here are the 6 contact centers. The one that you will likely get if you call is Arden Hills. But if Arden Hills happens to be backlogged in calls at the time, you could be routed anyplace else, and that's fine. They all have the information on all of the counties. The Senior LinkAge line is a SHIP program. That's the federal designation. There's one in every state. They go by slightly different acronyms. They do Medicare, long-term care counseling, the Senior Medicare Patrol, which is engaged in fighting fraud, which you know is rampant in Medicare, lots of opportunity for it. And then the Aging and Disability Resource Center, which has all sorts of resources to help people stay in their homes as opposed to going to an assisted living facility or a nursing home or something like that. Most people prefer to stay at home as long as they can. You can ask questions on any of these things. Long-term care partnership, the caregiver planning and support is a really big one. You know, nobody really plans to be a caregiver. You just wake up one morning and suddenly you are. And it's very strenuous. And caregivers need lots of support, and you can figure out what you need and where to get it by calling the Senior LinkAge line. Any state agency questions, we're taken care of. And They're always looking for volunteers. You want to run around and talk to people about Medicare, they're more than willing to take care of you. Or if you want to volunteer to be on the senior linkage line. Here's the booklet we talked about, Healthcare Choices. Really think you need to call and get a copy of that. Now on to Medicare. Minnesota has 1,007,000 people on Medicare. How's that? It's almost 20% of the state's population. That's quite a group, so you're in good company. Medicare, is a federal health insurance program. Started in 1965. You've probably all seen the photograph of President Lyndon Johnson signing the bill with former President Harry Truman standing next to him. Harry got the first Medicare number 1. His wife Bess got number 2. And the reason for that was that Harry introduced the first federal health care program into the Congress when he was a senator in 1945. It took 20 years. Medicare is open to people who are age 65 and older. That was the original membership. Later on, they added people under 65 with who were disabled and had been on Social Security disability for 24 months. People with ALS are also covered, as are people with end-stage renal disease, kidney failure. That's kind of interesting. ALS and end-stage renal disease are pretty bad diseases, but there are a lot of bad diseases out there. Why those two? Anybody know? It's really simple. 1965, 2 senators had relatives with those diseases, and that's what it took to get their votes. So we're still dealing with it. Medicare was created because 70% of adults at that time had no medical insurance. In fact, medical insurance, the way it is today, was very rare back then. It simply took off after that. And it was never intended to cover 100% of medical expenses, and it still doesn't. In fact, the parts it doesn't cover are quite a bit higher than in cost than they were back then. Medicare has 4 parts. Part A covers hospitals, and that's only when you're admitted as an inpatient. Forget about the building. If you're an inpatient in a hospital, Medicare Part A covers whatever the hospital and its employees provide you. So room and board, they furnish the operating room, any supplies you get. For example, if you get a stainless steel joint, as many people on Medicare do, Part A provides the hip or the knee replacement. But it does not provide the surgeon, the anesthesiologist, or any other type of doctor that may be involved in your surgery, because those people are not employees of the hospital. If they were, that would be covered by Part A. But fortunately, we have Part B, which covers physicians wherever they happen to work and all their services and things related. Just about anything you get in a clinic, ambulance rides, and so on and so forth are covered by Part B. That's the original Medicare. Had only 2 parts, A and B. Then in the 1990s, we got something called Medicare Advantage. Actually, we didn't. We got something called Medicare Plus Choice. And after a few years, somebody did a survey, and they found out that nobody knew what Medicare Plus Choice meant. So they renamed it Medicare Advantage, and now everybody understands it completely, apparently. Medicare Advantage is simply another way to get your services rather than from the federal government. We're going to talk about that in a little while. And then 2006, we got prescription drugs, Part D. Before that, there was very little coverage on prescription drugs at all. When you go on Medicare, you get a Medicare card. It comes from Social Security. It will tell you if you're receiving Social Security benefits when you turn 65, it will automatically enroll you in both Parts A and B. And if you don't want Part B, because you're still working part-time or something, you send the card back and say, hey, I'd like to defer. I don't need Part B right now. It's good to hang on to the card, keep it in a safe place. Its only legitimate use is to show that you are enrolled in Medicare to a medical provider. Don't show it to anybody else, and don't give it to anybody on the phone. Don't destroy your Social Security card. It does not replace your Social Security card. And somebody at the state of Minnesota thinks that it's important that you know that this identifier does not include the letters S, L, O, I, B, and Z. So now you know, okay? No, those are letters that can be misinterpreted if they're written sloppily and you can't tell an O from a 0 and so on. That's the reason. Medicare works this way. You start with Social Security. When you sign up, Social Security determines eligibility and collects your premiums and so on. And once Social Security says you're on Medicare, well, I better tell you, the Railroad Retirement Board does the same thing for people who are on railroad retirement. The Congress still retains the ability to change the Medicare law, and we hear a lot of noise about that, but not a lot of changes. And the Department of Health and Human Services is responsible for the administration of Medicare, but they designate that to the Centers for Medicare and Medicaid Services, CMS, which administers it, interprets the laws, pays providers, and also whenever you deal with CMS, you're probably going to be dealing with a contractor rather than a government employee. If you call their call center, those are contractors. If you get your semi-annual Medicare statements, they will come from contractors and so on. I said that if you're collecting Social Security when you turn 65, you're automatically enrolled in both parts A and B. If you're not collecting Social Security at 65, you have to do something to enroll if you want to. You can visit ssa.gov and enroll. You can call that phone number, or you can visit a local Social Security office. It doesn't make any difference. And you can sign up for parts A and B. If you're with the railroad, you enroll by calling the RRB office or that number there, 1-877-772-5772. Here's where we start to get complicated, and you have to understand this. When you want to enroll in Medicare, there are various types of enrollment periods. And these are confusing, they're complicated. Every year for the last few years, there's been a bill in the Congress called the Benny's Bill, which is trying to get the government to do basically two things. One is send everybody an individualized statement of what their choices are when they turn 65. And the second thing is to change the way all these different enrollment periods work so that they're intelligible to normal human beings, and maybe even align with the way that most people buy health insurance, which is they buy it in the fall for the following year, effective January 1st. But we're still stuck with what we have here. When you first become eligible, you have an initial enrollment period, and I'll show you what that means. It's the 7 months around your 65th birthday month. Now, if you continue to work, for example, you get, and when you decide you want to retire, you get a special enrollment period when you give up your employer health coverage. You can also get a special enrollment period for other things like, you have a Medicare Advantage plan, you move out of the service area, something like that. That lets you enroll in Medicare without penalty again. And then there's a general enrollment period, which is January 1st to March 31st every year, and we'll talk a little bit more about that. Here's how the initial enrollment period works. The central fact is your 65th birthday. You can start calling Social Security 3 months before your 65th birthday month and sign up effective the first of your 65th birthday month. That's when you want it to start, first of the month. You can sign up the month of your 65th birthday, it'll start the first of the next month. Or you can sign up in the next 3 months without penalty, but there are further delays. Here's that initial enrollment period, the 7 months, and if you don't sign up till the 3rd month after your 65th birthday, it starts 6 months after your birthday month, so there's another 3-month delay. So the point is, don't delay signing up for Social Security, for Medicare, when you know you're going to need it. You want it to start the first month you don't have any other health care coverage. People on disability, same 7-month rule, only the central month is the month that the 24th month of disability. They can start signing up 3 months before the month of their 24th month of their disability, or 3 months after. The special enrollment period. If you are still working when you're 65, you decide you don't want Part B because you don't want to pay for it because you have employer coverage, which is somewhat better, you can tell Medicare you don't want it. Tell Social Security you don't want it. And then when you retire, you have 8 months to sign up for Medicare Part B and Part A too if you haven't taken it. We'll get to that in a minute. And if you don't, you're going to be subject to enrollment penalties. Then, if you don't sign up in your special enrollment period or your initial enrollment period, you have to wait till the next general enrollment period. The general enrollment period runs from January through March of every year, and you can sign up for the same things that you could have signed up in your special enrollment period or your initial enrollment period, but your coverage doesn't start till July 1st. Now, why is this delay? This is one of the things that the Bennies Act is trying to get straightened out. So why would you use the general enrollment period? Well, one thing, as I said, if you didn't sign up for Part B when you should have, maybe you signed up for Part B but canceled it when you didn't have any other insurance because you decided, oh, I don't need it, I'm healthy, or I can't afford the premium or something like that. Or you didn't sign up for Part B within 8 months of losing your employer coverage. I don't know how anyone would do that, but they've managed it. The penalties, if you don't sign up, the Part B penalty is 10% of the Part B premium for every full year that you should have had the coverage but did not. So that can get pretty substantial. The Part B premium now is $144.60. And just to give you an idea, there are over 760,000 people paying this lifetime penalty right now because they didn't sign up at the right time. The reason for getting people to sign up at the right time is a typical insurance thing. You don't want people to wait till they're sick and then sign up for insurance. But most of these people weren't trying to game the system. They simply didn't know the rules, or simple common sense told them they probably didn't have to do it. But you have to follow the rules or you get stuck with the lifetime penalty. And that'll hit $1 million pretty soon. Here's what original Medicare Parts A and B cover. I said Part A is inpatient hospital, not for observation. You have to be admitted as an inpatient. Skilled nursing care, but only after a 3-day hospitalization and only for rehabilitation. If you need physical therapy, speech therapy, occupational therapy, whatever, you'll be covered. There's a certain amount of home health care that they will make available to you if that's all you need to stay out of the hospital. Hospice care is always covered by Part A. It can be delivered anywhere that hospice care is delivered, in a freestanding facility, in a section of a hospital, in a nursing home, or in your own home, where more and more people get it these days. They also give you blood transfusions. You pay for the first 3 pints of blood, unless it's been donated by the Red Cross or somebody else, and all the rest are free. Part B, these are the ones that drive us all nuts. We deal with these every day. Physician services, all the doctors you go to are covered by Part B. Outpatient hospital services, be it for observation or outpatient surgery, whatever, covered by Part B. There's a whole list of preventive services, about 22, 23 of them, I think. They're all free, but they're covered by Part B. Ambulance rides, Part B. Durable medical equipment, prosthetics, orthotics, and supplies, covered by Part B. There's also some Part B home health care, all kinds of therapy, and limited prescription drugs. It's limited to prescription drugs that are administered in a medical facility. These are not drugs that you normally pick up at the pharmacy. Those are covered by your Part D plan. But things like chemotherapy, kidney dialysis, the shots in the eye you get to stave off macular degeneration, and these all have one thing in common, and that's that they're very expensive. So you always want to keep your eye on Part B drugs later on when we start talking about additional insurance that you're going to want to buy. The other thing that's really expensive can be durable medical equipment. Some of it is, some of it isn't. A couple months ago I ran into a fellow who had a $28,000 wheelchair. Some of it's expensive. Prosthetics, often the bill is about $30,000 for an artificial leg or arm or shoulder. And you would have to pay 20% of that if you didn't have the proper coverage. And it also covers lab services, some of which are free, some of which you have to pay for. Now, what's it cost? Well, Part A is premium free, provided you have worked for 40 quarters or 10 years. Anybody not worked for 10 years or have a spouse that worked for 10 years? Okay, it's all free for you. But with Part A, there is a hospital deductible per benefit period. The first day you go to the hospital, it's going to cost you $1,408 as a deductible. Now, the next 59 days are free. So it's a good deal, but most people aren't in the hospital for 59 days or 60 days. So it works another way if you get out sooner. Well, let's say you're in the hospital for 3 days and you're discharged. If you come back again before day 63, you don't have to pay another $1,408. If you're there for more than 60 days, on day 61, the copay goes to $352, and it doubles again at day 91 for $704. Extended hospitalizations were much more common in 1965 than they are today. Most people don't stay in the hospital for 60 days. We talked about the skilled nursing facility for rehabilitation. The first 20 days you're in the nursing home for rehabilitation are free. Day 21 through day 100 costs $176 a day. The average nursing home cost around here right now is about $225 a day, so you get a pretty good deal. You can get limited home health care again if you need it, if that keeps you out of the hospital. Hospice services don't cost anything, but you might have to pay $5 for pain meds. And blood, you pay for the first 3 pints unless somebody's donated it. Part B, this is the one that gets most expensive. We start out, we have a premium for everybody, a monthly premium, $144.60 a month. You must pay that for the rest of your life, no matter what. Doesn't make any difference what kind of additional insurance you get. You must pay the $144.60. That goes up every year, of course. In addition, you pay an annual deductible of $198. So you pay the full Medicare price for the first $198 of expenses. Now, this is probably a good time to talk about the full Medicare price. Medicare has established an approved price for every medical service known to man. The last I checked, it was over 200,000 codes. There was a study done last year that showed that most Medicare approved prices are about 30% of prices paid by employers for employee plans. So if you have a high deductible plan and you see the big bills you're getting until you've hit your deductible, the Medicare price for that service will probably be about 30% of it. So that's a good deal for you. However, that doesn't really apply to two things, and that's the Part B drugs that are administered in the medical facility and a lot of the durable medical equipment, which is very expensive. Now, so just to give you an idea, what do you get for $198? Well, you could get about 3 visits to your primary care physician. You could get two and a half visits to a specialist, maybe 4 visits to a physical therapist, and maybe about 8% of a chemotherapy treatment. So that gives you an idea what you're going to get. Once you've paid your deductible, once you pay that $198, you pay 20% for most services. Some are free, so those you don't pay anything for. So you either pay 20% or 0. There's some variation with outpatient hospital services, special deals between the hospital and Medicare. Usually it means you pay less than 20%, not more. And so the preventive services, that list of 23, there's no cost sharing. Ambulances are 20%, durable medical equipment is 20%, home health care is always 0, therapies are 20%, those Part B drugs are 20%, that's too bad, and the blood, you get the first 3. Okay. These things are not covered by original Medicare. And the reason they're not covered is that Medicare says they're not medically necessary. So as you look at that list, how many of them do you think are not medically necessary in your view? It shows you how far we've come since 1965. A lot of these things have developed quite a bit since then. That's one of the things that the Benny's bill too is trying to get Medicare to start covering some of those. You can see that Medicare doesn't cover everything. So the reason most people come to these classes, I think, is because once you turn 64, you start getting mail from insurance companies. And they send you package after package after package, and it tells you absolutely nothing except that we have Medicare insurance and we're really good guys. Right? So actually, it's pretty serious business. You have to make a choice, and most people don't even know this. When you first sign up for Medicare, if you want additional insurance, and at least 90-some% of people do, there are 2 kinds. One is called a Medicare Supplement or a Medigap, and the other is called Medicare Advantage. They are very different. And we're going to go through them and tell you what those differences are. If you come equipped when you meet with insurance sales folks and you know the differences, you're way ahead of the game. Medigaps cover the gaps, obviously, Part A and B. They'll cover things like that $1,408 Part A deductible. It'll cover your 20% of Part B services and so on. The difference is that starting in 2020, if you turn 65 on January 1st of 2020 or later, you can no longer have a Medigap plan that covers the Part B deductible, the $198. If you turn 65 before January 1st, 2020, you can keep the one you have or you can buy a new one, okay? Now, what's the reason for this? Well, back in, I think it was 2015, it was 2010, someplace back there, the folks in the Congress decided that old people were running to the doctor too fast because they could buy insurance that didn't cause them to pay anything as they went to the doctor. So we're going to make everybody have some skin in the game by having to write a check. I don't know if that's going to increase or decrease medical usage or not, but I've read that probably psychologically speaking it doesn't hold water, but we've got it anyway. Medigap plans never cover prescription drugs other than Part B administered in the facility. You've probably seen television commercials that say that that's bad because you have to write 2 checks. Well, you have your choice of something like 28 different prescription drug plans that you can change every year to get the best price on your drugs if you aren't tied into one that's embedded in a Medicare Advantage plan. Medigap plans in Minnesota are standardized, and there are 7 of them that we're going to talk about, but no matter what company you buy one of these plans from, one's called an extended basic, for example. If you buy an extended basic from any of the companies listed that can sell in Minnesota, you're going to get exactly the same policy, no differences. The only difference is the premium and perhaps some customer service. I don't know how you evaluate customer service. The good thing about Medigap plans is that you don't have to argue with your insurance company. If Medicare pays, the insurance has to pay. So if you have a dispute, it's with Medicare. And that's a much easier road to go down than anything else. Premiums in Minnesota are what are called community rating, which means that everybody in the same circumstance pays the same premium. The differences are they can charge more for smokers and they can charge more for folks who reside in lower populated areas. With a Medigap plan, it's a guaranteed issue if you sign up for the plan within 6 months of starting Part B. Now, if you try to get one after that, they can ask you medical questions and not accept you. There's an exception to that, and that's if you start with a Medicare Advantage plan and within the first year decide you don't like it, you can also get a special enrollment period to get a Medigap plan without underwriting. These are transportable to other states because they have no provider networks. You can go to any provider in the United States that accepts Medicare assignment. That's 90-some%. You don't have to worry about your network, whether your doctor's in it this year or not. And there are various policy types, which we'll talk about. These plans are the original type of plans, probably the ones your grandparents had. Not much different. And once you buy one, you will have it forever. And because the terms of the contract never change. You know, we're all used to signing up for employer insurance and so on, and the first thing you do when you get that big pillow thing is look at it and say, okay, what's changed? With Medigap, nothing changes. Your benefits stay the same year after year after year. You don't have to worry about being at the mercy of the insurance company. On page 19, I think it is, of this book, Healthcare Choices, you will see this chart. The chart shows you the 7 different types of plans in Minnesota. Now, I'll make it easy for you. 3 of them aren't worth your time. The 50% plan, the 75% plan, and the 50% Part A deductible are not good. Together, they represent less than 2% of the Medigap plans sold in the United States. Their premiums are too high for what they cover. Their out-of-pocket maxes are too high for what they cover. So the others, if you do a careful evaluation, will win every time. People often ask me, well, where's the rest of the information? This is really all you need to know because it tells you things like this. The first plan is called a basic plan. It says it has no out-of-pocket limit. Well, that's true because they don't know what riders you're going to buy. It doesn't cover the Part A deductible, the $1,408, unless you buy a rider for it. It covers all your Part A coinsurance, those over 60 and over 90-day charges, anything else that you might have to pay on Part A. Then there's the skilled nursing facilities, of course, are 100% covered, even the $176 after day 21 or after day 20. The Part B deductible is not covered if you turn 65 after January 1st, 2020. If you turn 65 before that, you can buy a rider that will cover the $195. I'd like to tell you to just take a look at the premium, additional premium for the $195. If it's more than $195, you probably don't want it, and there are some plans like that out there. Part B coinsurance. All those 20% are covered under the basic plan. Something called Part B excess. Now, everybody knows what that is, right? Here's the deal. There are certain doctors, hospitals, etc., that do not accept Medicare assignment. If they don't, they can charge you 15% more than the Medicare approved price, unless they practice in Minnesota where it's illegal. So if you winter in California or Arizona, Texas, Florida, wherever you do, you could run into this extra 15%. If you don't want to risk that, you can buy a Part B excess rider, which will cover it. They're very cheap. They're $3 or $4 a month. Now, of course, it covers the preventive services that don't cost anything anyway. You can buy a rider that will pay up to $120 of additional preventive services that are not covered by Medicare. Again, look at the premium. If it's more than $120, you probably don't want it. Foreign emergency travel is covered at 80%. Just a word about that. Almost any plan you buy, Medicare Advantage or Medigap, has some foreign emergency travel coverage. And while they do vary the way they say they cover them, most people don't want to rely on Medicare to pay for their time in an emergency room in a foreign country. The problem is, when you come back, your insurance company is going to ask you to provide documentation. So you're here, the hospital is across the pond. They don't feel any real compunction to provide data that some American insurance company wants. So it might take a long time to collect your claim. You may never collect it. So do what you do now. Buy travel insurance. It covers a lot more. And if you get the payment from Medicare, that's fine, but you want to make sure you've got yourself covered. So most people who travel a lot buy travel insurance. There's an extended basic plan, which just to complicate things says it has a out-of-pocket limit of $1,000. It only applies to two things. One is foreign emergency travel and the other is Part B excess. If you're a Minnesotan, you're probably not going to pay either of those. So other than that, it covers absolutely everything. The next one, if we skip those ones that you don't want to talk about, has a $20, $50 Copay Part B. Strange title, but it's descriptive. You pay the $195 and $198 Part B deductible, and then you pay $20 for every doctor visit, $50 for an emergency room visit, and that's all. That's probably the third largest seller in Minnesota. It doesn't have an out-of-pocket limit, but the only risk is if you get caught paying a lot of $20 copays, something like kidney dialysis, where you get it 3 times a week, or lung cancer or some other types of cancer where you get 40 chemotherapy treatments. Then there's a high deductible plan. And this one works a little differently. It has a low premium, about $700 a year. And you pay the first $2,340 of your expenses. And once you've paid that, everything is free. So you've got a total limit, premium, and out-of-pocket for about $3,000. An extended basic plan will cost you around $2,400 with all the premium. If you have a good year with the high deductible plan, you're ahead of the game. If you have a bad year, you're going to pay another $400 or $500. So take your time, look at those and evaluate them, decide what kind of risk you want to take. Do you want to get a lot of bills? Do you want to get no bills at all? How do you want to do it? But it's a good thing to start studying before you go talk to an insurance agent. Let's look at Part C, Medicare Advantage plans. The way these work is the insurance company says, hey Medicare, we think we can do this job better than you can, so you give us a certain amount every year for everybody we sign up. Right now it's about $11,000. And let us have our own provider networks, lists of doctors and hospitals and so on. And we will give everybody everything they're entitled to under Parts A and B, plus some things. Plus, we'll give them a drug plan in most cases. And we'll be responsible. You don't have to deal with them at all anymore. And Medicare thinks this is a good deal because they've got their costs limited. They know it's going to cost them $11,000 or whatever per person. And the insurance company takes the risk. Now, you probably know insurance companies aren't known for losing money. So how much the risk is might be a bit controversial. They have to follow Medicare rules for the most part. They can make some small changes. They have to provide minimum Medicare services. If you're in a plan, you have to use their doctors unless you go out of network, in which case you usually can get a partial reimbursement, but it'll cost you more. We'll show you how that works in a little while here. You can't have a Medigap plan and a Medicare Advantage plan at the same time. That doesn't work. You can't have an additional Part D plan. In most cases, if the Medicare Advantage plan has drug coverage, you have to take it. And should you get a bright idea that you want to sign up for a standalone Part D plan, you'll get the standalone Part D plan, but you'll lose your Medicare Advantage or your health coverage. So you don't want to do that. They can offer additional benefits, like dental, vision, hearing, and gym benefits, gym memberships. These benefits vary widely. You know, the dental might be something like 2 cleanings a year and 1 oral exam, maybe some x-rays, and then others might be a little more substantial. Vision, it might include an annual vision exam, it might not, and it might include a 15% discount on glasses that you buy, or it might actually give you a reimbursement for the glasses you buy. You have to look at the plan and see what they're giving you. Now, in 2019, the Medicare Advantage plans were given the authority to offer some other kinds of benefits. And if you've seen Joe Namath or Mike Ditka on TV, you've heard him mention them. And by the way, Joe and Mike are my favorite insurance counselors. I go to them right away, of course. Things like medical transportation. They'll give you a certain number of rides to the doctor, a certain number of hot meals after you're hospitalized for surgery. In some cases, a free air conditioner. Everybody can use a free air conditioner, right? And various other things. The difference is these, the traditional benefits, dental, vision, hearing, and gym memberships, have to be offered to everybody who signs up for the plan. These new ones are discretionary. The insurance company gets to decide what their criteria is for delivering these services. So, for example, the air conditioner. That'll be limited to someone with some sort of a severe respiratory problem who lives in a non-air conditioned apartment. And if they didn't get air conditioning, of course, first heat wave, they're going to end up in the emergency room. That's expensive. So the insurance company can go put a $300 air conditioner in their window and save a lot of money. The medical transportation can be limited depending on your physical condition and how far you live from your doctors and so on. The free meals, well, it just depends on what kind of surgery you had and so on and so forth. So those benefits, the insurance companies cannot advertise. But Joe Namath and Mike Ditka can advertise them because they're working for a broker and they don't mention the name of any insurance companies. There are several types of Medicare Advantage plans in Minnesota. I'll just run through them quickly. There's the HMO. To get your benefits there, you pretty much have to stay in their network. HMO with a point of service option means you can go out of network, it's going to cost you more. Preferred provider network, they will have a preferred network and they'll let you go outside again for additional costs. Private fee-for-service plan, if you live in the metro area, so you can't get one of these. There's one from Humana that's only offered greater Minnesota. The deal with that one is that the doctor has to agree to treat you every time you come in or you can't collect. So you can sprain your right ankle and go in and get it treated this week, and 2 weeks from now you can sprain your left ankle and go in and the doctor can say, nah, I don't think so. And you have to go find another one. These were around, probably 15 years ago, quite a few of them, and they've all gone away. Then there's the thing called the medical savings account. This is one that was around several years ago. It's now come back. And I'm going to show you the example of the one plan we have. Then there are special needs plans, mostly for people who are eligible both for Medicare and Medicaid and have certain types of conditions that require a lot of care coordination. This is an example of a page out of the Healthcare Choices book. There's a page like this for each one of the Medicare Advantage plans. There are 30 of them in Minnesota. And it breaks things down for you. It gives you an out-of-pocket max. This one has an out-of-pocket of $4,300 annually in network, and combined in and out of network, $6,000. So if you can't stay in network, have to go out, you might have to pay $6,000 out of pocket. The premium is $45.70 a month, so that's $500 and some a year. There's no health plan deductible. Medicare Advantage plans, you don't have to pay the $198 Part B deductible. Some of them do charge a deductible, but it's not mandatory. If you're hospitalized, it's going to cost you $300 a day for the first 5 days. Now, with original Medicare or Medigap, if it's not covered, it's $1,408 on day one. So if you're in 5 days, it's going to cost you a little more. If you're in 1 to 4, it's going to cost you a little less. Physicians, $10 for primary care, $40 for specialists. If you go out of network, it's going to be 40% for primary care and specialists. So the numbers we got here, $10 and $40. $10 is just a little less than most primary care visits are at 20%. If you go out of network to a primary care physician, it's going to cost you 40%, so quite a bit more. And a specialist visit is usually less than $40 at 20%, but pretty close. Ambulances, $250 a ride. Outpatient surgery, $300. That's just for the outpatient facility. You also would have doctor bills in addition to that. What else is interesting here? Urgent care, $90 copay, that's emergency care, $90. And copay for urgent care is $40. Travel coverage. They give you rules of what you can do if you go outside of their service area. Each of these plans has a service area which is defined by counties in Minnesota, groups of counties. If you move outside of that service area, you have to get another plan. But if you just travel outside, you have to follow their travel rules. And they change for every year. They can change every year. So you have to call and say, hey, I'm going to California, what's the deal? This one, they require that you notify them. So if you come up with normal medical bills and you didn't notify them, they probably won't pay them. Now, just to be clear, no matter what kind of a plan you have, you're always entitled to emergency care and urgent care. You don't have to worry about networks. If you need an emergency room, go to the nearest one. But if you winter somewhere and you need ordinary type services that aren't urgent or emergency, you need your glaucoma checked, or your wooden leg isn't working right, or something like that. You can, if you have a Medigap plan, you just go. If you have a Medicare Advantage plan, you have to check and see what their rules are on that. Diabetes supplies, 20%. That's a big deal for a lot of people. They get expensive, and sometimes they get in short supply. A Medigap plan, because it covers Part B coinsurance, would pay for all or most of it. They have dental benefits, chiropractic. Chiropractic is very limited under Medicare. It's only for something called subluxation of the spine. In other words, they straighten you out a little bit. All of the other services that are offered by chiropractors are not covered. There's some vision. They give you a discount on hearing aids. I've heard some audiologists say certain things about the hearing aids that are offered by Medicare Advantage plans. I don't know anything about it, but they don't seem to think much of them. Part B drugs are going to cost you 20% up to your out-of-pocket limit of $4,100 or $6,300, $6,000. The two things, of course, that will drive you to that out-of-pocket maximum are Part B drugs and durable medical equipment. It does have Part D. Well, it gives you a little information about the Part D deductible, which we'll cover in a little while. So you've got these plans which they slice and dice all of the services and price them differently, as opposed to just covering them by Part B, Part A, and so on. And these change every year. You have to look at it every year and see what they've done this time. Now, there's one exception to all the things I've told you about Medicare Advantage plans, and that is the Lasso Healthcare Medicare Advantage Medical Savings Account. This is the one that's new this year. The only reason I want to tell you about it is to make sure you really understand it's different and you have to do some research. Here's how it works. It's good in all 87 counties. The premium is $0. Okay, sounds pretty good, right? It gets better though. If you sign up for this plan, before the first of the year, they're going to send you a debit card loaded with $3,240. It's yours. That sound pretty good? Yeah. The purpose of that is to let you pay your Part A and B expenses for the year with the $3,240. However, you don't pay them according to the regular rules. You're paying everything at 100% of the Medicare approved price. So there's no Part A deductible, $1,408. You go to the hospital, you're probably going to eat up the whole $3,240 plus the $4,160 that you have to pay out of your own pocket for a total of $7,400. The idea is if you spend less than the $3,240, that money is still yours. And as long as you don't use it for some non-medical purpose, it's not taxable. If you use it for car repairs, it's taxable. And they know what you spend it for. So, there's no network with this one. You can go anywhere that accepts Medicare assignment. And it does not include drugs, so you can buy a Part D drug plan. Is this a good deal for anybody? It's hard to say. I wouldn't advise somebody new to Medicare to take this plan. I'd rather see them take a high deductible Medigap plan that isn't going to change over time. But what about somebody who's in a Medicare Advantage plan? They have some kind of a condition that won't let them pass Medigap underwriting, and they maybe can't find the specialist that they need. in their network. You know, they live in St. Louis Park. The nearest specialist who's taking new patients is in Stillwater. That's not really acceptable. Or they perhaps have a drug that's not on the formulary of their Medicare Advantage plan, or it's very highly priced, and they know they can get it cheaper someplace else. Maybe this would be a good choice for them to jump out to save money on the drug or travel costs to the specialist or just plain access to the specialist. But, you know, it's something that don't think about it a lot before you sign up for it. And be sure you read the document called the Evidence of Coverage. That's what Medicare Advantage policies are called. They're about 160 pages long. They change every year. Most people don't read them every year, but, you know, you really should. Medicare has open enrollment periods for Medicare Advantage and Medicare Part D every fall. From October 15th to December 7th, you can change Medicare Advantage plans. You can change Part D drug plans. The changes will be effective on January 1st. Then, just to keep things a little complicated, starting January 1st, we have the Medicare Advantage enrollment period. So if you start the year on a Medicare Advantage plan and you decide you don't like it, either because you've got problems with the provider network or you find out that they changed the pricing on your drugs or something, and you want to get out, you can get out anytime between January 1st and March 31st, and the change will be effective the first of the next month. You only get one change during this period, and if you're still in a plan on April 1st, you're locked in for the rest of the year. This used to be only a 6-week period, and that really wasn't enough. A lot of people didn't realize they had a problem until after that. You can also, if you want, get out of the Medicare Advantage plan and go on original Medicare and get a Part D plan. It does not entitle you to a Medigap plan if you can't pass the enter rating. Now, just to summarize, the key differences between the two types. With the Medigap, you've got the limited guaranteed issue where they have to give you one within 6 months after starting Part B or the first year of a Medicare Advantage enrollment. Medicare Advantage, there's guaranteed issue all the time. They have to accept you unless you have end-stage renal disease, kidney failure. And that restriction goes away next year. Medigap plans are standard. All companies give you the same policy. Medicare Advantage, the provisions vary by company and by plan. You have to read the long document to find out what you have. Medigaps, no provider network, exception of something called the Medicare Select, which there's only one. It's called the Blue Cross Senior Gold. And that restricts you to the Blue Cross network. In this case, it's about 98% of all the providers in Minnesota, so it's not a big deal now. Could be in the future. Medicare Advantage, provider networks, they can and do change almost daily. So if you see your doctors are in the Medicare Advantage plan that you sign up for in the fall, they may not be there in January. Policy provisions never change in the Medigap plans. Medicare Advantage changes every year. Medigaps are portable. They're good anywhere in the United States. You have to live in the service area and follow travel rules if you're in a Medicare Advantage. No drug coverage on Medigap. Medicare Advantage usually has drug coverage, and if they have it, you have to take it. Medigaps have very few non-Medicare benefits. They have been told they can give some, but we don't see a lot of it yet. Few companies are giving gym memberships. And Medicare Advantage has standard benefits, and I'll call them non-standard benefits that don't have to be offered to everybody. It can be difficult to change your Medigap plan. You have to have your insurance company's permission, and But most people don't want to change it. There's really not much of a financial difference top to bottom. And of course, with Medicare Advantage, you can change plans every year. Everybody here lives in the metro area, so they can't get a Medicare cost plan anymore. They all disappeared last year. Anybody ever have one? Aha, okay. They are only available in the green counties on the chart here. You'll see they're mostly low populated counties where there isn't enough Medicare Advantage competition. The blue counties, cost plans are prohibited. That doesn't mean that they all voted Democratic. Now, we're going to talk about Part D drug coverage to close up. Medicare Part D is unlike any insurance plan in existence today. It is extremely complicated. It's almost impossible to understand, and it's just in general a can of worms. So what I'm going to do is try to convince you that it's really complicated and there's only one way to find out how to pick a plan. They're offered by private insurers. All Medicare Part D does is says you can buy a plan that Medicare approves from one of these insurance companies. There are 28 different insurance companies selling standalone Part D plans, and almost all of the Medicare Advantage plans have them too. With each of these plans, you pay a monthly premium. Each plan has to have a formulary, which is a list of drugs that they cover. If your drug isn't on the formulary, they're going to sell it to you for whatever they consider the full price of the drug to be. Veterans who get benefits through the VA may not need a Part D plan. Every plan has a preferred drug pharmacy network, some general retail networks, some non-participating networks. So generally, a preferred network will give you lower prices, but not always. And the others will give you higher prices. And it's very difficult to figure that out. Now, if you don't sign up for Part D and you sign up later, there's going to be a premium penalty of 1% of the annual average premium for every month that you could have signed up but didn't. And that's not an awful lot of money, but because the premium is in the mid-$30 range. The real penalty is this. You don't have coverage and you're suddenly diagnosed with something that requires a very expensive drug. You can't get a drug plan until the next fall during the annual enrollment period, and it's effective on January 1st. So if you get hepatitis C in April and you need that $1,000 pill, you need 84 of them in 12 weeks, or is your liver going to hold out till January? Tough decision. So in my opinion, everybody needs a Part D plan. Even the worst ones will keep you from paying that $84,000. I guess I didn't tell you back on Part B that if your income is high enough, you might have to pay a higher than the $144.60 premium. The limits start $87,000 for taxable income for a single person and $174,000 for a couple. And if you hit those limits, you're going to have to pay the $144.60 plus $57.80, and your drug coverage will be whatever the plan charges plus $12.20 a month. And it goes up from there. Now, people who are subject to this aren't very happy about it, but the good news is that they're in the top 5% of Medicare beneficiaries, income-wise. This chart is in your book, I think, and I don't like it. So I'm going to tell you how it really works. Every plan has a premium. You have to pay it. They vary from $13.20 a month to something like $89.60 a month. That's quite a difference. So you pay the premium, and then each plan has a deductible. The maximum deductible is $435. Now, normally you'd say, okay, that means I have to pay the first $435, right? Well, sometimes, but not always. Because the plans put all of their drugs on 5 tiers, 5 pricing tiers. And the number of drugs is from something like 2,800 to 4,500, depending on the plan. Each drug goes on a tier. Each tier charges the same price for each drug, for every drug on the plan. So, tier 1, very low cost generics, usually a 0 premium or something around $5. Tier 2 will be preferred brand drugs, more expensive generics, might cost you $10, $12, $15 per month. Tier 3 gets more expensive, and it'll either be a number like probably typical $45, $50 a month, or perhaps a percentage of the cost. And then tier 4 is usually the most expensive one. That will usually be a percentage as high as 50%. At least that's the highest I've seen. And then biologics are on tier 5, and they're usually in the neighborhood of 25 or 30%. So, have I lost you yet? I hope so. No. So, as I said, some plans require you to pay the first $435. Others say, okay, tier 1 and 2, or maybe tier 1, 2, and 3, are not subject to the deductible. So starting out the year, we'll let you pay the pure price on that rather than the full price of the drug. The thing is, in some cases, the tier price is more than the full price of the drug, but you're unlikely to know that. Then the top 2 tiers are usually, are always subjected to the deductible, and those are your very expensive drugs. So once you and the cost paid by you and your insurance company hits a little over $4,000, you will go into what's used to be called the donut hole. Officially, there is no donut hole. I'm not really sure what it's now called, but there's still something there. But once you hit that level, you will pay 25% of the cost of the drugs. High-cost drugs, the ones you were paying 50% on tier 4, will drop to 25%. The drugs you were paying 0 for will go up to 25%, so you'll suddenly be paying, $5, $10 for them. But once what you and your insurance company have paid, it's $9,038.75. You hit the catastrophic period. When you hit that, you will pay 5% of the cost of the drugs. And there are some lower copays if 5% isn't too much. And then 95% is paid by your plan. That's the good news. You get into that 5% bracket, your costs drop. Bad news is the year's almost over and you're going to reset on January 1st. There is help available for people who have trouble paying for their drugs. It's called the Low Income Subsidy, commonly called Extra Help. You apply for it through Social Security. They approve you and tell you which type. There are 2 levels of low-income subsidies. There are a lot of people are eligible for this who don't apply for it. So don't be afraid to apply if you're having trouble paying for your drugs. If you know anybody who's doing things like rationing their drugs or cutting their pills in half or things like that, be sure they know about this plan so they can apply and might even take care of their whole problem. You see, this first level, $89 deductible, the premium is sliding scale based on income. You're only going to pay about 15%. Your plan will pay 85%. So make sure they know about it. Then there's the full extra help for people whose income is even lower. No premiums, no deductibles, very low copays, $130, $390, and so on. And it's very affordable. So if you know anybody who could possibly use this, certainly have them apply. Things to consider in making your Medicare decision. I think we've pretty much covered all of these. Now, your employer health coverage. Anybody have a high deductible plan with their in a HSA? Okay, you retired yet? No. Okay, you cannot have any part of Medicare and still contribute to an HSA. So if you're turning 65, you're still going to work, don't sign up for Part A, even though it's free, because that disqualifies you from contributing to an HSA. If you don't want to contribute to the HSA anymore, that's fine. If you can switch to a PPO plan or something the previous fall when open enrollment with your company comes, that's fine. But you can't be on any part of Medicare and contribute to an HSA. If you do that, you're going to be subject to a tax penalty. The IRS will send you a letter later on. And if you're still working and you decide to, 2 months from now I'm going to retire. So you sign up for Part A. 2 months from now, Part A goes into effect. However, they're very generous about this, and they make it 6 months retroactive because you could have had it. You're over 65, could have had it. So the IRS then additionally says, hey, he was illegally contributing to HSA and sends you a bill for a tax penalty. There is a way you can appeal it, but if you can stop contributing 6 months ahead, it's a good idea. If you're still working at 65, you have good employer coverage. You can delay Part B, as we said before. There's no point in paying that $144 premium if you're not going to use it. Some people, however, they'll get that card in the mail, and it says they're already enrolled in Part B. They assume they have no choice. So they pay the premium anyway and never use it. Don't do that. Send the card back, say, I don't need it. When you stop working, you have 8 months to sign up for Part B without penalty. Why anyone would take 8 months, I don't know. But you have 8 months without penalty. You only have 2 months, though, for a Part D plan. Consistency is not a value for Medicare. You see,
They could have
not part of the deal.
Insurance coverage.
Yes.
If they retire and they have 8 months, they could have continuing employment insurance.
Oh, if they retire but have a continuation of insurance, no. They may have a continuation of insurance, but they're no longer covered by the definition of active group coverage. You have to be working. So you have to sign up.
Or anything like that, even if it's company paid.
Nope. If you have COBRA and you turn 65, you have to sign up for Part B. You may want to keep the COBRA because it's covering your dependents, but you have to sign up for Part B. Who pays first? Well, if you work for a company with 20 or more employees, your employer plan pays first. Medicare would pay second. Your company has fewer than 20 employees. Medicare pays first, the employers pay second. If you work for a company with less than 20 employees, they can ask you or require you to sign up for Part A and B when you turn 65. Employer's group plan, after you retire, Medicare pays first, the retiree pays second. If you have COBRA, Medicare will pay first, COBRA will pay second. Here are the extra help and assistance programs. We talked about the low income subsidy for Part D. There are other county programs that will pay part of your Part B premiums, or maybe all of it, and your copays and so on and so forth. This information, again, is all in the Healthcare Choices book. Be sure you get it. And of course, we have medical assistance, or Medicaid, which is you get with a county application. And then there are prescription assistance programs. Let's say your drugs are still too expensive with your Part D plan. There are drug companies that have special plans that give price breaks to people. And the senior linkage line knows where all these are. So give them a call, see what they can find for you. The other thing with all these applications, if you've ever looked at a government application, you know they're not easy to understand. So take a look at it, get the information together that you need, call the senior linkage line and say, walk me through this thing. I mean, that saves everybody a lot of time if you do that. I mean, don't guess, just ask them to help you fill it out. And here's one more, senior partner care. This is not insurance, but it's pretty good for some people. It's designed for people who don't qualify for the county programs, but still have trouble paying for their medical bills. It covers only Part A and Part B, but not durable medical equipment. It's administered by Senior Community Services, and you can't have any additional insurance. You have to have Medicare A and B. You can't have a Medicare Advantage, a Cost, or a Medigap Plan. You can't have a Part D plan. You have to fill out their application. You pay an application fee. The last time I checked, it was $25 a year. And you have to renew it annually. It doesn't continue on. It's a very good deal for people who need it. Just to eliminate the confusion, there are actually two of these around. The Senior Partner Care by Senior Community Services covers most providers around except for Allina. Allina has their own program. So if you call Senior Community Services and start talking about providers and so on, if they see you're better off in the Allina plan, they will make sure you get there. They're not going to sign you up for their plan. Healthcare fraud, we know about it, billions every year. You can do it by protecting your card, review your 6-month Medicare summary notices if you're not on a Medicare Advantage plan. Make sure that your Medicare isn't being billed for services that you did not get. And while I'm at it, Medicare.gov, which is the government's website, has a little thing called a My Medicare plan you can sign up for, and all of your Medicare summary notices will show up there. So you don't have to wait for the paperwork. They'll send you an email saying you got a new one, and you simply sign up, read it, and if there's any problem, you can report it. Here are all the places you can go for help. They're all listed in the book. They're all on the Senior Linkage Line website. Don't be afraid to call any of those numbers. If you call and ask a question that they're not responsible for, they'll tell you where to call. So that's the end. And as I look around, I think I achieved my objective of making everyone's eyes glaze over, right? Okay. Questions? Ooh, I really put you in trouble, didn't I?
Where do we get that book again? The Medicare?
You call.
Call the Senior Linkage Line, 1-800-333-2433. It's in your book. Yeah. Just call them, you'll get it. Yes?
How long do we keep the evidence of coverage? Do we need to keep more than the current year?
How long do you keep the evidence of coverage?
Yeah. You ever have to show retroactively?
Well, you know, your bills for a given year are usually not all paid in that calendar year. So I would keep it at least for the next year. But even past years are online, so it's not too bad if you throw it away. Any others? Well, if not, thank you very much for your attention. I really appreciate it. Call the Senior Linkage Line. If you need personal counseling, we have people who meet in senior centers for an hour appointment once a month. Call the Senior Linkage Line, see which senior center near you or library or church has an opening, and they'll let you sign up to talk to somebody in person.